The first step is finding a dentist that will work with you and your RADS. That's not as easy as it sounds, because in my experience it took me about 5 dentists before I actually found one that was willing to work with me and accommodate me with all of my uniquenesses of having RADS. So yeah, finding a dentist, don't be surprised if you need to ring a few. Of course, explaining about your RADS to the dentist, the obvious things, asking them if they're willing to not wear perfume, aftershave, fragrances, things like that are really helpful. Also discussing your specific triggers, what things you know that set you off. Also having a plan of action just in the event that there's things that happen during surgery or during a procedure. What I found really helpful is if the dentist is going to try something, they'll open it just outside the room and just ask me if I have any sensitivities or reaction. They don't need to bring it right up to my nose, which has happened in the past where they're thinking they need to bring it right up near me to see whether or not I'll react, but I'll be able to smell it way behind me near the door. So I've just found that's the best way to test things, is just keep it away and test it a bit further away from you. Also having a plan in action. I had a situation where a dentist came and put Bond on my tooth and I had a really serious reaction. So she stayed calm and quickly got 2 suctions and suctioned the smell out of my mouth. I did have my oxygen with me, but that would have blown the smell down my throat and caused even more problems. So they're just things to think about. Using suction and suctioning smells out worked really good for me. As I mentioned, learning what things you're sensitive to, they can catch you by surprise. So having a plan and discussing that with your dentist so that you're both prepared, I think is really useful. I've also found in my experience that it can cost a little more due to having RADS, and just the fact that the dentist might have to go to extra lengths to help accommodate you could cost you a little bit extra for different procedures. So just be prepared for that if that happens. If you're able to have your appointment first thing in the morning before any other patients, I found that really helpful. Then you don't get the residual smell from other people that have been in the waiting room or in the surgery. Another thing is I generally wait outside and they'll ring me to say come in if there are any other people in the surgery. Something else I do is I'll ring the dentist usually the day before just to remind them about no perfume, and they can let their assistants know as well. A lot of dentists I've been to, they won't wash their hair if they know that they're seeing me, so that's been really a huge help. One dentist did forget and she smothered her hair with a towel and wrapped it up tight so that when she was near me I couldn't smell any of the conditioner smell, so that was again really helpful. One of my dentists had the sterilising unit in the room I was going to be in, so they moved that out prior to me getting there, so that was great. Just moved it to a different room so that I didn't have another smell to have to deal with, so that was really helpful as well. Also using non-latex gloves, that was helpful. My dentist also used a low adrenaline for me, and that worked in my situation, so I was okay getting needles and the anaesthetic to numb your gum, and then just low adrenaline. So I seem to be fine with that, but again, you need to check for your particular situation and see how you go. having dentures made. I'd never had a plate or anything made before, so that was a real learning curve. I found a wonderful denture guy who has a separate laboratory to where I see him in the surgery, so I sit in a different area so I'm not getting exposed to any chemicals. For making the plate, they have to do an impression, and he ended up using a product called alginite, which is from Cavex, and it's made in Holland. I think it's made from seaweed, but I had no reaction to it, which was fantastic. And he made the plate, but the denture is what's called MMA free. So again, I've had no severe reactions at all to that, but he did put a thing called a tissue conditioner on the plate at one stage, and I had a big reaction to that. So we got rid of that. And it took me a couple of days to get over that, actually. And we recently just tried building up the plate again, and he used a product he'd usually used before, but I reacted to it, so they got a brand new batch of it, and the second time round I haven't reacted, so we just weren't sure whether or not that batch might have been off. So a lot of it I found is trial and error, and unfortunately, because each time we have to adjust the plate, we have to do an impression each time, so it's quite a lot more expensive than if I didn't have RADS. So just something to think about and be prepared for. He said that there's another plate called a Velplast, and it's inert and commonly used for people with allergies. But as soon as I can afford it, I think I'm going to go for screw-in teeth, and if I can get them done locally, because I don't travel like by plane. So I'll see how I go. But for now, this'll do. So I hope that's helpful to people out there. Okay, see ya.